Again, tonight our topic is Ask Us Anything. We have Jared Vaughn, who is with us here from Gadsden tonight. So glad that you're with us.
So great to be here.
If you have a question for Jared, call us 855-LAW-1955. We have Pat from Forestdale, who's been holding so patiently on the line. Pat, we appreciate that. If you will, go right ahead with your question.
Thank you. Good evening to each of you all.
Good evening.
Hey, Pat.
If you have medical problems with paying your medical bills, what effect does it have on your credit? And also, if you do file bankruptcy on those particular bills, can the doctors or hospitals deny you treatment if you put them into bankruptcy?
Those are
Great questions. Really good
are.
questions.
Fantastic questions.
Jared, your advice for Pat tonight?
There have been a lot of updates as far as the federal law is concerned as it relates to how and what impact a medical bill in per se has on any individual credit report. So the good news is that however much weight that carried previously, that it is now less than it used to be.
That's right.
The follow-up into that question was, can they deny you coverage if you place any of those bills into a bankruptcy? That's a trickier question because you get into whether or not it is emergent care and whether that care is necessary, and you get into a lot of complicated things. The answer is maybe, and it's unfortunately that the answer is that often as an attorney, but it's fact, circumstance specific, and the answer is it depends. Normally, no. If you filed bills and had bankruptcy at one particular hospital and then had a heart attack and presented to that same emergency room, they are bound ethically to give you treatment. So in that regard, you can still get the treatment necessary, but there may be some other specific instances where that bankruptcy could have effect on other specialty treatment.
And I know we've had a lot of wonderful bankruptcy attorneys on the show.
Yes.
I would imagine that might be the first stop for Pat to speak with a bankruptcy attorney.
Certainly.
No doubt. And hospitals and physicians are much different. Hospitals, there's some federal law that mandates that they treat patients under certain situations.
Okay.
An individual practitioner, just your family doc, has a lot more latitude about figuring out who he wants to see, unlike a hospital. So, Pat, the good news is if you have an emergency and you show up at a hospital, they are not going to deny you care.
That's great. That's great.